Hello, everybody. My name is Corey Higley. I am a physician here at MedStar Georgetown University Hospital in Washington, D.C. I'm going to spend the next 3 or so minutes talking to you about acute pancreatitis, diagnosis, guidelines, and healthcare utilization. I think it's important to give a little background first. So in the top left-hand corner, you can see that acute pancreatitis is quite costly. Billions of dollars a year are spent on this disease. And it's also important to understand where this estimate is coming from. Well, it's coming largely from epidemiological studies, which are using ICD-10 codes and diagnosis codes. A little bit of a review. The revised Atlanta classification is nice in that it standardizes the way that we diagnose acute pancreatitis. So there's 3 criteria. You need 2 of them, of course. And there are several guidelines out there that have recommendations for how we manage acute pancreatitis. There's one in particular I want to focus on. It states that we should be estimating the etiology in approximately 75% of cases of acute pancreatitis. And there's another one that states that we should be using ultrasonography as the preferred image modality. Moving over to the methods section in the top right-hand corner, you can see that within the MedStar Health System, which is approximately 10 hospitals in the Mid-Atlantic region, we found about 4,000 patient encounters that received an ICD-10 code that equated to acute pancreatitis within the years 2015 and 2019. Of those, only about 2,500 actually had complete charting with extractable data. These are the variables that we looked at, and of course we did statistical analysis. Moving to the results section, of the 2,500 patients that we had that had received an ICD-10 code for acute pancreatitis, about 1,900, so about 75% actually satisfied revised Atlanta classification. This table is nice because it shows a quick breakdown. Of course, as we already stated, you only need 2 of the 3 criteria to meet the diagnosis. So this states that which is the most common 2 criteria satisfied, and that's pain and lipase. So even though the diagnosis was already established, 90% of these patients, these patients right here, ended up going on to get imaging. And of the imaging that was obtained, cross-sectional imaging with CT or MRI was the most common, with contrast. Ultrasound was second at 18%. I think it's also important to understand that etiology was identified in only 65% of these patients, which actually brings us to a conclusion. These are all the main points, but I did just want to highlight the main one, and that would be that many encounters that are receiving an ICD-10 code for acute pancreatitis may not actually satisfy the revised Atlanta classification. And this is really important because diagnosis codes, or rather it may suggest that diagnosis codes may not be the most accurate way to track healthcare utilization. If you have any questions, please feel free to email me. Thank you so much.